your questions. Yes, sir.
Hey, Reza, is your expectation, the professional's expectation, that this thing is just going to mushroom? Like already two other schools have announced they're closed today. So any of these contacts or people who, like several hundred people probably went to Christ Church on those days, and if they're supposed to self-quarantine, this thing is just going to keep spreading in a quick and large way, isn't it not?
Well, we see what's happening across the country, and certainly we want to put our city in the best position to respond and to care for people who have been exposed, and to make the best decisions we can for our students and staff and all the staff of D.C. government. Yes.
Excuse me, Mayor, I was just kind of curious in terms of the recommendation, self-quarantine. Is it a CDC recommendation? Or is it a Department of Health recommendation?
To self-quarantine for the
members of
Christ Church. Let me turn to our doctors at DC Health, Dr. Todd Walker.
So it is a DC Health recommendation that is consistent and grounded in the science of the CDC. So there are very clear guidelines during disease transmissions when we are trying to control the spread of disease about what we should do to manage risk of exposure. Throughout the contact investigation, when we are identifying people and places who are exposed to positive cases, we collect information to get a sense of what that exposure risk is really like. So throughout our investigation, we determined a certain level of risk for these contacts of our case, which is medium risk. And there are very clear guidelines as to what the strategies for managing that risk are for that category of risk. So that is what we're following. That is the instruction that was given to the church members.
Can we clarify, is that anyone who visited the church, whether they're feeling ill or fine, anyone should self-quarantine for 2 weeks?
For those dates, yes. So that is when we have identified the February 24th, February 28th to March 3rd. That is when our case was symptomatic. So anybody who was potentially exposed during that time, out of caution and best practices for disease control, that's the recommendation.
Do you have any idea how many people that might be?
So where are you coming from? Sorry.
Do you have any idea how many people that might be?
So several hundred people were potentially impacted, had interactions with the positive case during those dates.
Can you tell us what kind of interactions? Was he giving out communion? Did he have direct contact, physical contact with these parishioners?
So the definition for close contact, which is what I would provide as opposed to the specifics of the actual case, when we talk about close contacts, it is a person who is within 6 feet of a positive case who is having symptoms, and that usually includes also interacting with that person, but that's the CDC definition, is really within 6 feet. It also could mean close contact with a secretion of a positive case, again, who is symptomatic. The other category that's medium risk that that's not really applicable here are people who live with the positive case while they're symptomatic, but they're able to be in a separate bedroom, use a separate bathroom, potentially have protective gear in their interactions. So all of those kinds of contacts are considered medium risk and would follow this guideline.
Did this minister give out communion while he was infected?
So we wouldn't give out the actual specifics of the case. But based on our investigation and what we've identified as the exposures, we're categorizing it as medium risk and following the standard protocols for that.
Can I follow up on the patient or the woman we know as Maggie from social media? When I asked you this question on Saturday, you said that the reason she wasn't tested is she didn't meet all the CDC protocols. She had just been in an airport, and that she was getting better. Right after that, her family took to social media to dispute that, what you said Saturday, and the fact that she was not getting better. I'm just wondering if, once again, you could address that.
Sure. So we have been in contact with the patient. We have been in contact with the provider. So we have made a decision and a determination based on the factors presented to us to test the case. And that's all the information that I'd want to give on any particular individual.
Has she been tested now?
Yes.
She has been tested and is awaiting results?
The sample will be delivered to the lab, and then the results will be out after that. Mm-hmm.
I'm curious as to wonder if you think this is a time where there is to be declared a state of emergency. You're recommending several hundred people at the church self-quarantine, a few schools have closed as some precaution, and we can declare a state of emergency, and also to the status of the Cherry Blossom Festival.
I am evaluating if I need an additional power that I could achieve through a public health emergency, and that would be to impose quarantine if that became necessary. And we have 2 positive cases, both hospitalized, and if they are discharged from the hospital where they still need to be quarantined, I would need that power. So I'm doing that legal review. I'll brief the council, and I will make that decision probably later today. Yes.
Mayor, you mentioned in a previous your unique situation and powers that a state of emergency might be less necessary than another mayor of another city due to the unique structure.
Or governor.
Or exactly.
Yeah.
Can you walk me through?
Sure, and I'll turn to Chris Rodriguez to talk in some specifics. But sometimes a state of emergency will allow the chief executive to impose some actions on lower municipalities. We don't have that issue. But what the state of emergency will allow us through a public health emergency is the big critical thing here is to impose quarantine if that became necessary. All of the cases and all of the situations we've been talking about today involve self-quarantine. So it's a recommendation from DOH that we expect people to follow. More than that, let me have Chris, where's Chris, come to talk about the situations of price gouging. I could also, with an emergency, require closings in that case. So let me ask Chris to talk about it.
So, Chris Rodriguez, Director of D.C. Homeland Security and Emergency Management Agency. So as the mayor said, a declaration of a public emergency would give her expanded powers, and there's a long list of them, but some of the more significant ones, as the mayor mentioned, is to prevent price gouging, to impose curfews, to regulate business hours. So those are just some, and of course, as the mayor mentioned, also to impose quarantine. So those are some of the key authorities that a mayor would have under a public emergency, and so that's what we're evaluating at this time.
So are you guys considering curfews?
No. What I'm considering, as has been stated twice, Mark, is having the authority to do the things just mentioned by Director Rodriguez. Yes. And let me get to somebody who hasn't asked a question yet. Yeah.
A question about preparations and with regards to, we've got some people hospitalized already with positive COVID-19. We've heard a lot about shortages with regards to disinfecting supplies and personal protective equipment. Can you talk a little bit about how we're sort of ramping up in the possibility that we're going to see more positive cases?
I can certainly talk to you, and I'll turn to Director Rodriguez again to talk about the types of supplies that the district has ordered, and we will continue to order. We have also, and we will not be talking about a location at this time, but we have also secured a lease in the case that we have to have a quarantine facility, and then we will, as I look through how we work with our private sector, because we know that there are a lot of people who are very concerned about disinfectants and the like, and if we need to get involved in that.
So as the mayor mentioned, we have been in constant contact with our first responders, making sure that they have the equipment that they need as they are on the front lines. So far, since the mayor signed her order, a little over a week ago, we have centralized procurement through the district's Emergency Operations Center to ensure that our first responders have a single point of contact to go to. And again, at the mayor's direction, the Office of Contract and Procurement, the Office of the Chief Financial Officer have also stepped up the momentum in terms of pushing through a lot of procurements that are coming through. So far, we've had 25 requests, separate requests, for a variety of things, including N95 masks, For our first responders, we've ordered over 42,000 of them. In speaking to the fire chief, right now they are confident that they have what they need. But again, in the event that we need more, we will have them on hand.
Will you also be working with the hospital systems?
Yes.
I'm sorry. I mean, so that will also be coordinated through the centralized office, is that right? And what are the supplies looking like in that respect?
Well, the centralized procurement is for what the district government needs at this time and for what our first responders need.
Okay. Yes.
Yeah, I know we have to go on living and all that, but there have been 2 conferences here in the district, APAC and CPAC.
CPAC was in
in
Maryland.
National Harbor, right?
No, that's Maryland.
Yes. But in this
Not
area.
technically, actually.
Are you concerned that you might find out a week or 2 from now that here at the National League of Cities, someone had it and you've been exposed by just coming here today?
I am very focused on how we prevent the spread of germs and how we prevent the spread of COVID-19. We are not aware of any risk for this conference or others, and we continue to tell people if they're sick to stay home, don't attend conferences like this, and expose others. If the science tells us something different and that we need to amp up our concerns about meetings, then we will. I don't believe that's where we are right now. Yes.
What about businesses, particularly small businesses, who are starting to feel the pinch? We've heard anecdotally from Chinese restaurants that people are not coming out to their restaurants to eat because of fears about this. Is there anything that the government can do to help these businesses, or what would you say to people who are, staying in and staying away from public gatherings?
Well, what we know is, and we will continue to work with our federal government. We think that the federal government has a role to play, not only in making sure that we have the necessary supplies, testing kits and the like, which is crucial, but there may be a need for economic relief as well. And we think that we will be looking to the federal government to work on that. We will have some conversations about and with what we can recommend to the members of Congress or the administration. Yes.
Yes, Mayor, just kind of curious about the timeline of things. I mean,
Sure.
can you help us understand the reasoning for saying this today as opposed to earlier yesterday when the news broke that it was a rector at the church? So I'm trying to understand the rationale for making this announcement, on a Monday morning as opposed to Sunday.
Well, I think DC Health concluded its recommendations for self-quarantine late last night, and they began issuing that information to congregants at that point. So I think the earliest we were really prepared to make the comments about Christ Church Georgetown were late last evening. Yes, Sam.
So I've heard that, for example, the head of a charter school was expressing some concern that if, in fact, the school was shut down, would they go out of business and things like that? Is that the same thing, or is it the concern for the stores, or is it one of those things where budgets have been passed so people continue to get paid? I think there's
I'm not sure I understand your question, Sam.
Well, my understanding is that the head of a charter school is concerned that if, for example, the school is shut down, right, that how do they pay their staff? I think that was one of the big concerns.
I would be very interested in talking to that charter school leader. That is not how it works. That's not how it works.
Then fine. Can I just ask generally what we've learned today? I just want to make sure we get it straight. So patient number 1 was a minister at a church.
Correct.
And you're recommending that anybody that went to these masses between February 24th and March 1st.
Let me repeat it.
Yes.
So you don't have to repeat it. I'll repeat it. DC Health is recommending that anyone who visited Christ Church Georgetown, either on February the 24th or between February the 28th and March 3rd, self-quarantine themselves at home for 14 days from the last time they visited the church.
And that's patient number 1.
That's correct.
And patient number 2 was a Nigerian who visited D.C. for 1 day he had contact with people here. The people have tested negative so far, but he's hospitalized in Maryland. And because one of those people worked at School Without Walls, you're recommending that the school's closed today, and they're deep cleaning the school for that reason.
Yes, and let me be clear about my decision to close the School Without Walls today. And it was for the purpose of communicating with staff and teachers and parents, who I'm sure have a lot of concerns, and doing it in an orderly way. And making sure, because one of our employees had a close contact with an infected and symptomatic person, even though our employee does not display any symptoms, I made the decision to do it out of an abundance of caution so that our communications with family and students could be orderly. And I expect the school to reopen tomorrow and staff and students to return. Yes?
I want to ask about the Cherry Blossom Festival again.
Yeah.
Do you have plans for precautions, things like that?
Well, we have, as you know, a number of festivals. The large, and I have a list somewhere of some festivals through April 3rd who have gone through our committee, our public space committee, our special events committee, and so there are a number of them, largely conducted outdoors, and it is our expectation that they will continue. Yes.
Just kind of curious, I mean, for the folks at the church who don't have sick leave, if they stay out of work, they may lose a job, what do you say to the people who don't have the luxuries that some other people have to self-quarantine and stay at home?
It is not, we don't see it as a nice to. It's a must to. If you've been exposed, you need to self-quarantine. And we recognize that there will be hardships for many people, not just in D.C., but in Maryland and Virginia. We know that there were congregants, not just from Washington, D.C., who attend Christ Church. We have some safeguards in Washington, D.C., however, with accrued sick and safe leave. And we hope that people are working with their employers to take advantage of that, which goes up to, for the most part, covers that quarantine period.
Mayor Bowser,
Yes.
Governor Hogan took some action to ensure that those without medical insurance and those with big copays would still be able to get testing and treatment. Are you taking similar steps? What happens to people who either don't have health insurance in D.C. or large copays when it comes to getting tests and getting treatment?
We'll work with our providers, and if we see that is happening, we will have our insurance commissioner address it in the coming days. We, as you know, Mark, unlike many places surrounding us, just about everybody in Washington, D.C. is insured. The copay issue may be an issue that I'll look into and address. Yes.
One more question. Just kind of curious in terms of the city's outreach to the homeless. I mean, the homeless will have access to regular water like other folks do. What's the city been doing to outreach to the homeless in this scare of COVID-19?
Did you ask about water?
Water, yes. Yeah, I mean,
Okay.
yes.
For hand washing.
Hands, yeah.
So we, and several weeks ago, our Deputy Mayor for Health and Human Services made a big order of hand sanitizers. You know that we have street outreach teams that are working with all of our residents who are unhoused and providing that hand sanitizer. And we continue to ask them to sanitize frequently and also watch their symptoms.
Last question for Mark.
Yes. Did you?
I had a question.
Okay. Mark's head.
Go
ahead.
What kind of precautions are DC agencies taking? Like, I was at the DMV this week, and there's hundreds of people there by 10 o'clock. So what kind of things are agencies like that taking?
Let me ask the city administrator to talk about agency preparation.
Sure. Thank you, Mayor. We've been communicating with our agencies about proper hygiene practices and hand washing. We've made sure our agencies have orders for hand sanitizer sanitizer, and putting those in our public facilities. And we're pressing the message that we're pressing to the general public that anyone who is symptomatic or has symptoms consistent with COVID-19 to stay at home and not engage with the public. And so as we talk many times throughout the week and really throughout the day, we're checking for any new information that would give us cause for concern, but we are providing that kind of sanitary messaging to our employees through posters and emails, as well as making sure they have the supplies they need.
Mark, you good? Okay, thank you, everybody.
We now return to our previously scheduled program, already in progress.
The Department of Health advised her that she couldn't be tested even though her doctor advised it. So how do you know that there's not cases like this that could be coronavirus cases is that you guys just aren't aware of yet?
Sure, so I'm happy to have Dr. Tallwalker